Hello, and welcome to the video series on compounding and IV/IM nutritional therapies. I am Lori Harrison, and I am with Innovation Compounding. I will be presenting over this two-part series. We are going to cover quite a bit of information, but in this first video, I will discuss compounding pharmacies, who we are, what we do, and how to choose one, why now may be a great time to implement IV therapies, and considerations for starting your IV therapy business. Before we dive in, let me first give my disclaimer and then introduce myself and my company. As I mentioned, I am employed by Innovation Compounding, and please note that the following information is for educational purposes only, has not been reviewed or approved by the FDA, and it is certainly the responsibility of the provider to prescribe and administer the appropriate treatments for their patient. Since we're going to be spending some time together, let me provide a brief introduction to who I am. I have over a decade of compounding experience with a particular focus on IV and IM nutrition and weight loss therapies. I am a certified integrative nutrition health coach, and I have been in the health and wellness space for over 20 years. I consult with providers and practices across the country who are looking to implement IV nutrition or weight loss therapies in their practice or to build upon what they currently offer in these areas. I can provide education, we can talk about best practices, IV protocols, and generally just be a resource for providers so that they have a place that they can ask questions. As I mentioned, I am with Innovation Compounding. We are a compounding only pharmacy located in Kennesaw, Georgia. We are licensed as a 503A compounding pharmacy, and we have PCAB accreditation. We support prescribers and practices across the country by providing over 100,000 prescriptions annually. We offer both sterile and non sterile compounds in a variety of different therapeutic areas. Innovation Compounding offers compounds in the areas of IV, IM nutrition, weight loss, dermatology and cosmeceutical, women's health, men's health, hormone pellet therapy, allergy, pain management, and others. I'm often asked, why IV therapy? Why is this something that I should add to my practice or offer for my patients? So, I wanted to cover some of the drivers for IV nutritional therapy in an outpatient setting just to give you um, some ideas about why IV therapy is becoming more popular or you're seeing more of it offered in clinics nowadays. I'm actually going to start at the bottom of this slide and work my way up. So, first and foremost, there's just a lot of nutritional deficiencies that we're experiencing. That could be from absorption issues like leaky gut or just anti aging, where we're not absorbing the nutrients from our food like we once were. And then also, our current food supply. We're oftentimes eating a lot more processed food nowadays. We're so busy and hurried, so it's oftentimes just easier to grab something that's pre-made. So really the food we're taking in is not as nutrient dense as it once was. I'm not sure if you have heard of the acronym for the Standard American Diet, or SAD, just kind of referencing the nutritional quality of what most of us are eating nowadays. Like I mentioned, kind of combine that with leaky gut or absorption issues, and we're just not taking in all the nutrients that we may need. Benefit to IV therapy is that it is 100% bioavailable, so that allows for improved absorption over oral therapies. When you take oral supplements or oral therapies, we just don't know how much of that you're absorbing and how much your body's utilizing when it's going through your GI system. So with IV therapies, they are 100% bioavailable. And then with IV therapies, Because it's delivered straight to the bloodstream, it bypasses the GI system during administration. So that allows for proper dosing and adherence. And you can oftentimes achieve higher serum concentration of nutrients to reach specific therapeutic levels that aren't available with other routes of administration, such as oral. So, IV therapy can definitely play a role with helping to kind of reach those specified serum concentrations for therapeutic levels of the nutrients. And then, of course, we certainly have drugs that induce nutrient depletion. And I'm by no means saying that patients don't need to be on those medications, but certainly just something to be aware of that certain medications do or can cause nutrient depletion and the role that IV therapy could have with helping those patients out. And then we take a look at our current healthcare climate. So nowadays, people are often talking about, wellness and whole body medicine. So we're really looking to optimize the wellness and health of our entire body, not just focusing on one specific system, but looking at the body as a whole, and increasing nutrients and optimizing the functioning of the whole body. And then the prevalence of nutritional testing, which a lot of providers now offer in their practice, gives you the flexibility to kind of customize those IVs for patients that may be showing deficiencies with certain nutrients based on that nutritional testing. And then, of course, you do have the social aspect where, we're seeing a lot of celebrities nowadays posting videos and pictures on social media of them getting their IV therapies. So it's just an increased awareness and then increased access to information and news about vitamins and supplements and IV therapy. So I think it's just more people are aware of IV therapies, and certainly something that I see patients are seeking out. So if it's not something that you're offering in your practice, then they certainly may be going somewhere else, or going, somewhere down the street to get those IV therapies that they're seeking. We've talked about drivers for IV therapy. So now let's assume that this is definitely something that you want to add on to your practice for your patients. So, what are some things that you need to consider in moving forward? Well, one of the biggest things is going to be your menu and what you want to offer. So, that includes your IV protocols. Whether or not you will have IM injections also for your patients. You want to think about your patient population, who you will be treating, whether your IVs will be kind of wellness based, or whether you're actually looking to treat, health conditions or chronic conditions with some therapeutic IVs, what marketing you will be putting together. So, those are some of the things related to your menu that you just need to consider and moving forward. One of the biggest things of that is IV protocols, and we're going to dive into that a little bit later in the second part of this series. So we'll touch back on that because that can be one of the biggest obstacles when you're getting started with IV therapies. And then certainly you want to consider your nutrients and where you are sourcing those from. When you're mixing medications, what are your state regulations, or what guidelines do you need to follow in mixing medications? You can certainly, for some of those regulation questions, you can reach out to your state licensing board, your state medical board, even your state boards of pharmacy, to see what the regulations are for your specific state in mixing medications. And then also with the nutrients, you just want to make sure that you have some resources for that ongoing clinical support as you're looking to put together protocols and start adding these IV therapies for your patients. You just want to have some resources where you can go to ask questions and make sure that your IVs are safe. Things like, what medications can't be mixed with anything else. For example, glutathione, always needs to be infused by itself. And then any specific laboratory requirements that may be necessary for your IVs that you're going to offer. So things like that. And then lastly, look at the administration of your IVs. Are you going to have a mobile clinic, or are you going to have a brick and mortar location that patients will come to? And then where is that location going to be? Think about your staff, how many people you will need to help run the IV portion of this business. As I mentioned, any labs that may be required for your patient's therapy. So just some different considerations as you're looking forward and looking at moving forward with adding IV therapies onto your practice. Let's talk about the supplies that you would need for your IV therapies. So there's several places you can look to for the supplies. One would be your medical supply companies or your wholesalers. So that's where you're going to find your commercially available medications, also the carrier fluids that you're going to need for your IV therapies, and then any supplies to administer that IV. That could be things like your IV catheters, your IV tubing, your tourniquets, alcohol pads, even your IV poles. So all of those types of things you can source from your medical supply company. Now, you may even want to check with them and see if they offer something that's like an IV start kit. IV start kits generally are everything you would need to start one IV. Those can be useful if you are just getting started with IV therapies and you're not really sure how many IVs you're going to be doing, and you're not quite ready to order big, in bulk or big cases of your carrier fluids or your needles, and you just kind of want to get that IV start kit so that you can get going and have everything you would need to start your IVs. Those IV start kits can also be helpful if you are planning to have a mobile IV business or administer IVs on site. That way you can just grab one kit and carry it with you. And again, you have everything you need to start your IV. Now, for the nutrients or medications that are not commercially available, that's where you want to look to a compounding pharmacy for those nutrients for your IVs. Now, you will find that compounding pharmacies can supply those medications, but not all compounding pharmacies are going to be doing sterile compounding. So you really want to look for a compounding pharmacy that specializes in IV therapy so that they can be there to answer questions for you. They have a wide menu that you can order from, especially as you're looking to grow this IV business or the service that you're offering for your patients. So I've included a few points that you just want to look into as you're looking into compounding pharmacies or who you may want to work with on the compounding side. So certainly you want to make sure that compounding pharmacy is licensed to ship in your state. So 503A compounding pharmacies are licensed by the State Board of Pharmacies for each state. Here at Innovation, we are currently licensed to ship into 49 states. So you just want to obviously confirm that the compounding pharmacy you're working with is able to ship into your state. You also want to make sure that compounding pharmacy is adhering to USP 797 guidelines for sterile compounding. And then ask the compounding pharmacy what types of testing they do on their medication. The compounding pharmacy should be very open with any testing that they're doing, and happy to share results with you if you're questioning any type of testing that they're doing. Here at Innovation, we do sterility and endotoxin testing on every sterile batch that we compound, and we don't release that batch until we get those test results back, making sure that everything was okay with that medication before we would dispense it to you, the provider, to use on your patient. So as I mentioned, you also want to look for a compounding pharmacy that may have a diverse menu of sterile compounds for you to use. This is going to be helpful just so that you can, develop that relationship with that compounding pharmacy, and they can be a resource for you with all of these different medications that you may be using on the IV side, particularly if you're looking to kind of expand into unique IV therapies. It's helpful to work with a compounding pharmacy that does have a pretty diverse menu of sterile compounds so that you're not ordering from different places, which can sometimes just be cause logistical problems when you're ordering from numerous pharmacies for particular medication. So it's great to work with a compounding pharmacy where you can kind of keep everything under one roof and have one place that you're ordering from for all of your medications. You also want to look for a compounding pharmacy that has experienced staff with IV nutrition and sterile compounding, and people that are easily accessible to you to ask questions to, particularly providers that are new to IV therapies or just getting started. You're going to have a lot of questions that come up, particularly in the beginning. It could be things like, what medications can you safely mix together, or what medications need to be infused by themselves. You could be looking at different types of carrier fluids, looking into the osmolarity of the IVs that you're going to offer to make sure that they're safe. Could be looking at what types of carrier fluids are most compatible with particular medications, any safety concerns of particular medications. So, a lot of questions that come up, and you want to make sure that you have a reputable resource to ask those questions to regarding the medications. Your compounding pharmacy you're working with should be available, should be able to answer those questions for you. They should be able to provide you with osmolarities for their medications. So these are just things to look into as you're considering what compounding pharmacy to work with. You certainly want to make sure you're working with a compounding pharmacy that is accredited and has been through inspections. If you are looking at a compounding pharmacy that has been inspected by the FDA, you can always check out the FDA's website for the results of those inspections. Um, Also, you know, think about a compounding pharmacy that has good customer service and a good reputation. You can always ask around to other colleagues that are doing this. You want to make sure that they're available should you have any issues that arise with orders, and that they can help you with that in a timely manner. So, just a few things to consider for the supplies that you're going to be looking for your IVs, whether you're getting using a compounding pharmacy or wholesalers, medical supply companies. You just want to make sure that you're developing that relationship with that company so that they'll be a resource for you as you're starting with IV therapies. That concludes our first video lesson. So let's recap what we learned in this video is some different drivers for IV therapy and why now may be a great time to start or expand your IV therapy business. Some various considerations as you are looking to get started with IV therapies, and then also resources and compounding pharmacies and how we can be a great asset to you in offering IV therapies for your patients. In our next lesson, we are going to cover building your IV protocols, selecting of your carrier fluids, and osmolarity. So I look forward to sharing more in the next lesson. Hello, and welcome back to part two of the compounding and IV/IM nutritional therapies. In this lesson, we are going to talk about building your IV protocols, osmolarity, and then we're going to talk a little bit about what we offer as a compounding pharmacy and resources for your medications and support as you are offering IV therapies in your practice. So let's jump in. As I mentioned, I am employed by Innovation Compounding, and please note that the following information is for educational purposes only, has not been reviewed or approved by the FDA, and it is certainly the responsibility of the provider to prescribe and administer the appropriate treatments for their patient. Okay, so you're ready to start your IV therapy business, but where do you even begin with the IV protocols? What do you offer? What do you put together? Oftentimes, I find this is one of the hardest parts for providers when they are starting an IV therapy business. Um, I usually recommend that you think about who your patients are or who may be coming in for these IV therapies and what types of problems they may be seeking help for on the IV side. That will help kind of guide you into thinking about what types of IV protocols you want to offer. I also recommend that you usually start with just a few protocols on, keep your menu kind of small as you're getting started and used to what the protocols are, used to the workflow, getting a feel for how long the patients are going to be in the office when they're getting their IVs. Just by having a smaller menu, this will help you kind of work through some of those. initial phases, and then you can certainly grow your menu. You can add on to it based on either what you're seeing a need for in the practice or what patients may be requesting. So generally just kind of start with a small menu for your IV therapies. Some of the common ones I have listed here, you'll find Myers, immune support, energy support, even just simply hydration. Some of the other ones listed here would be common ones that I see practices getting started with. And this is where your compounding pharmacy can definitely come into play and help you with kind of putting the medications together for these specific protocols based on what they offer. When you're looking to order medications that you'll need for your IV therapies, as I mentioned earlier, you can order commercially available medications through your medical supplier or wholesale companies, or you can order from compounding pharmacies. Now, with compounding pharmacies, you may find that they have several different options for how you can order the medications or how the medications are supplied. And you can kind of, what I find is most providers end up using kind of a mix and match of these different options to create the different protocols that they want to offer in their practice. So you'll have just the individual medications, like your B12, your vitamin C, glutathione, or those individual medications that are supplied in a vial where you could just draw up from that vial for your dose that you need for your IV therapy. Another option you may find are pre-mixed options. Now, this is where you're going to have multiple medications mixed together in a single vial. So by drawing up out of that vial, you're getting multiple medications in that one dose. Now, this is convenient if you're looking to minimize the number of vials that you're using for your IV therapy or minimize the number of vials that you're drawing up from. Here at Innovation Compounding, we have several different pre-mixed options. Just as an example, we have our vitamin blend, which is a combination of several different B vitamins as well as ascorbic acid or some vitamin C. And all of those are premixed together in a single vial. So when you draw up out of that vial, you're drawing up all of those medications into that one syringe to use for your IV therapy. And then another option that you may find with compounding pharmacies are different IV protocol kits. Now, this is usually where you have all the medications you would need for that specific protocol supplied together. It's just a convenient option for you to order medications for a specific protocol instead of going through and ordering each medication individually. Now, all of these options can be helpful for your IV therapies. It's really just a matter of determining what's going to be the best fit for you and your practice and your specific IVs that you want to offer. And working with a compounding pharmacy that can kind of help you um, put together or structure your IV protocols with the medications or the options that they have for ordering can be really beneficial as you're getting started with this. One thing just to be mindful of when you are ordering medications is whether you're ordering multi-dose vials or single-dose vials. So you will find with each medication that it may be a multi-dose vial, which means it has preservative in it, and that vial can be punctured multiple times. Now, with multi-dose vials, you do need to keep in mind that according to USP guidelines, once that vial is punctured, it does need to be used within 28 days or the medication's beyond use date, whichever is sooner. And then the other option may be preservative-free or single-dose vials. So those vials do not contain preservative and are essentially one-time use. So you would draw the medication you need out of that vial. If there's anything remaining, then that would need to be discarded from those single-dose vials. So just make sure you understand what types of medications you're ordering, whether they are preserved multi-dose vial or if they are single-dose vials. It's good just to be mindful of that. Now that we have covered some different options that you may find from compounding pharmacies, I wanted to dive a little bit deeper into what we offer here at Innovation Compounding so I can show you how you can kind of marry your ideas for IV therapies or what you want to offer there in your practice with the medications that may be available to you to order. So what you see here is a picture of our individual vials of medication. You can see there are different sizes. And also behind that, you'll see our prescription template for what we call a la carte ordering. And that means just ordering individual vials of medication that you will put together in your practice for your IV therapies. Now, the prescription template, I know the print is a little bit small. That's because we have a fairly extensive menu of different medications that you can order a la carte. So here you'll see an A to Z list of the medications that we do compound for either IV or IM use. Beside each medication, you will find that medication strength, and then you'll also find whether or not that medication is a multi-dose vial or whether it is preservative free. So that can be helpful just to know when you're ordering how much you need to order for your patient's course of therapy. Also, keep in mind in regards to the strength of the medication, the strengths are not always going to be universal between compounding pharmacies. So just make sure if you are ordering from several pharmacies or if you're changing pharmacies, that you are mindful of the different strengths that compounding pharmacies offer in these medications and that you can adjust the volume that you're drawing up or infusing accordingly on your end if you're making some of those changes or ordering from different pharmacies. Now, you will also see on our prescription template the vial sizes as well as uh, the column down the center that's kind of a lighter shade of red. That lets you know whether or not each medication is safe for either IV and or an IM route of administration. I often find that practices that are offering IV therapies also want to have some different IM options available for their patients as well. Now, we do have a variety of different medications, just single medications in a vial. We also have several different pre-mixed or combination products that you will find on this a la carte prescription template as well. Some that maybe you may be interested in or may be helpful for your practice. We have one that we offer that is a vitamin blend, which is a combination of several different B vitamins as well as vitamin C or a ascorbic acid. That is, again, a pre-mixed combination. It is supplied in a preservative-free vial for you to draw up the whole entire vial and use that for your IVs. We also have another premixed option that is a mineral blend. So that's where you're going to get a combination of several different minerals, such as magnesium, manganese. We also have some zinc in there and some others. Again, that's a great combination that you can just draw up, add to your bag, and you can also, mix the vitamin blend and the mineral blend together in the same bag to have a really nice comprehensive Myers. Some of the other combinations that we have a few different amino acid blends, and we also have some of your MIC B12 or also what we call a super B plus MIC combination. So several different options under the combination products, again, that can be useful if you're looking to limit the number of vials you're drawing up from and want to have those multiple medications within a single vial to use for either your IV or your IM options. Now, another option we have for ordering are the IV protocol kits. What you see on the screen here is an example of our Myers kit, and then again, behind that is our prescription template. Now, on our prescription templates and with our kits, we do give you what I like to call the recipe of how much of each medication to draw up per infusion. And with our kits, they are supplied with enough medication for 4 infusions per kit. So that just assures that you have all the medication you need for that specific protocol and enough medication for 4 infusions. Now, here at Innovation Compounding, we offer several different protocol kits. We have a Myers, an Immune Boost, chelation, several different strengths of high dose vitamin C, hydrogen peroxide, and phosphatidylcholine. And again, this just allows you to order all the medication you need for that specific protocol and have that on hand instead of ordering each individual medication separately. Now, there is some flexibility with our Myers and our Immune Boost kits with your carrier fluids and how those are administered. And we can definitely talk about carrier fluids. We're going to touch on that next and how to choose your carrier fluids. Okay, so we've looked at, what you may find available on the market there. We have talked about what innovation compounding specifically offers. So now let's kind of put it all together and get to the heart of it with the different protocols that you want to offer in your practice and how do you kind of marry that with the medications you will find available. So I have a few just examples here on the screen of protocols that I commonly see practices getting started with and different options for each of those on how you could create that based on what we offer here at Innovation. Now, it really comes down to how your practice is structured, the IVs that you want to offer, the flexibility you want to incorporate for your patients, or if you want to incorporate any customizations for your patients when you're offering these protocols. Those are the kinds of things that we would look at and discuss if we were going to have a conversation about your unique practice and your unique protocols that you want to offer. Just to give you, some examples or some tangible things that you can look at here. Myers is a common one that people want to offer. A lot of people are familiar with that name. It's a great, just kind of general wellness type IV to support many different conditions. So you could look at for your Myers using a combination of our vitamin blend and our mineral blend. That would allow you to draw up from two different vials. Those are both combination therapies or combination products. So you would just be drawing up from each of those vials, putting that in your bag, and you're ready to go. Now, another option for your Myers could be looking at our Myers IV protocol kit. Now, that is where you're going to get the individual medications that you would draw up according to the recipe that we give you and add that to your bag for your Myers IV. Now, they both have a place. They both have benefits that you can consider. Again, it just depends on your unique practice and what you want to offer, kind of the customizations and flexibility that you want to have at your end. For example, if you're looking or if you're using our Myers IV protocol kit, again, you'll get the individual vials. So if you have a patient that maybe is sensitive to magnesium, you could choose at your end to kind of cut back the dose of that magnesium or not use the dose that's listed in our recipe. If you want to cut that back a little bit, if you have a patient that's sensitive to magnesium, you can choose to do that when you're drawing up that IV from that protocol kit. However, if you're using those premix combinations of the vitamin blend and mineral blend, you don't have as much flexibility to adjust that dose if that's something that you're looking for, if you're looking for that customization on your side with your patients. So just, things to think about as you are deciding which options you want to go with for creating your protocols. And this is where your compounding pharmacy can really come in handy, again, with thinking about what protocols you want to offer, how your practice is structured, what flexibility you want to have on your end, and then marrying that with the different options that you have from the compounding pharmacy. Another just kind of option that we can look at here within these would be if you're looking for something to support the immune system. We certainly have our Immune Boost IV Protocol Kit, which is going to be similar to our Myers, but you also have some added antioxidants with that kit, such as glutathione and acetylcysteine. So that could be one option for you for an immune supporting IV. Or you may choose just to have your own combination of medications that you want to put together for that IV. If you want to create something on your own, for example, you may consider, a combination of vitamin C or adding some zinc to that, some different B vitamins or a B complex in that. So you certainly have the option just to create your own unique protocols for your specific practice based on what you want to order. And again, your compounding pharmacy should be able to help you with looking at those protocols and IVs that you want to offer and what various options they may have to meet your specific needs. And then just kind of talking through that to look at your unique practice and what is going to be the best fit for you and your patients. We've talked a lot about the medications and available options that you have for ordering and creating your IV protocols. So let's talk a little bit about the carrier fluids. So there are also different carrier fluids that you can have for your IVs. Now, carrier fluid is definitely important, and some things to consider when you are looking at carrier fluids for your IVs would be the compatibility of the carrier fluid with the medications that you're using. There are certain medications that are just more compatible with specific carrier fluids. And that is something that your compounding pharmacy can discuss with you if you're ordering specific medications or something that they should be able to help you with. So, outside of compatibility, the other thing that's important to consider when you are looking at carrier fluids is going to be its contribution to the osmolarity of the bag. And we're going to touch on osmolarity next. So let's talk about osmolarity for your IVs. Osmolarity is very important to calculate and know as you're administering your IVs. The definition of osmolarity is really just the concentration of the solution expressed as the total number of solute particles per liter. And osmolarity is very important because it can cause a fluid shift either in or out of the cells based on where that IV falls in the different osmolarity range. Now, the blood is a certain osmolarity. That is that middle range you see there on the screen, or the isotonic. Now, you certainly can infuse an IV that falls either in the hypertonic range or in that hypotonic range, but just some certain things that you need to be aware of if you are infusing IVs that fall in either of those ranges. First, we'll start with a hypotonic range. So if you are infusing an IV that's in that hypotonic range, it is going to cause a fluid shift into the cells for the patient. So those IVs are actually going to be very hydrating for the patient. Now, that may be important if that's a specific goal of your IV. If you are doing an IV on a patient who um, has dehydration or maybe is recovering from an illness and hasn't really been taking in the fluids that they need, and you want to do an IV on them to help hydrate them, or if you have a patient that maybe is struggling with chronic headaches, and you want to make sure that you have that hydration aspect on board with your IV, then you may want to look at something that is in that hypotonic range so that, again, it really causes that fluid shift into the cells and hydrates the patient on a cellular level. However, we don't recommend that you infuse anything that has an osmolarity below 200 milliosmoles per liter. That would be kind of a hard cutoff. Anything below that range could certainly cause some hemolysis for the patient. So you just want to, again, know where your IVs fall with their osmolarity to make sure that what you're infusing is going to be safe for the patient. So let's talk about the other end of the spectrum and the hypertonic range. Now, those are osmolarities that are higher than that of the blood, and those IVs are going to cause a fluid shift out of the cells. So those IVs in particular are actually going to be dehydrating for your patient. Now, a lot of people think that just anytime you're getting IV therapy that it's always going to be hydrating, and that's not necessarily the case. It really depends on where that osmolarity falls in this range. So again, if you have your IVs that are in that hypertonic range, they are going to cause that fluid shift out of the cells and be dehydrating for the patient. Now, an example of that is going to be your high dose vitamin C infusions. Vitamin C itself just has a very high osmolarity. So, particularly when you're doing those high doses of vitamin C, those IVs are fall well into that range, well into that hypertonic range. So those IVs are going to be dehydrating for your patient. Something important to know and obviously make the patient aware of, practices will often give the patient some water or some fluid to drink while they're getting those high dose vitamin C infusions, and just make sure the patient's aware when they leave your practice that that IV may be dehydrating for them, and just make sure that they're drinking plenty of fluids to rehydrate during the day. Now, osmolarity is not universal between either commercially available medications or even between different compounding pharmacies. Even if the medications, are the same medication, the same strength, those osmolarities can definitely vary from compounding pharmacy to compounding pharmacy. That is something that your compounding pharmacy should be able to provide for you and help you with those osmolarity questions. Um, when you're looking at calculating the osmolarity, it can be a tedious calculation. You have to look at the osmolarity of each medication, the volume of that medication that you're adding to the bag, and you have to kind of look at that for each medication that's going in your bag, and then you have to look at that for your carrier fluid as well. Now, here at Innovation Compounding, we do have an osmolarity calculator that makes those calculations very easy for you, but it is specific to our medications because that's pre-populated in the calculator, our specific osmolarity, so it would not apply if you're using either commercially available medications or medications from different compounding pharmacies. Again, your compounding pharmacy should be able to provide those osmolarity values for you to make calculating that osmolarity of your bags easy. With osmolarity in mind, let's look at a tangible example of how you can change up the type and the volume of your carrier fluid and the impact that may have on the osmolarity of the IV that you're infusing. The example I have on the screen here is simply using our Myers kit, and I have outlined 3 different options that you have with that Myers kit. And again, we're using the same recipe, the same Myers kit for each of these infusions. The only thing we're changing up is the type and the volume of the carrier fluid. Now, in the top example, that's giving our Myers as an IV push. That is an option with the Myers kit, but you may or may not want to offer IV pushes in the practice, but I just like to have it on here as an option to show you this example with the osmolarity. So with using just a small volume of sterile water for that IV push, you can see the osmolarity is well in that hypertonic range and over 1,000. Now, if you want to give that Myers as just kind of a quick drip, you could use a 100 milliliter bag of sterile water, and that puts the osmolarity down at 338, which is in that isotonic range. So with that option, the infusion is going to be, pretty isotonic, not really cause a fluid shift one way or the other. And then the last example here for our Myers kit would be to use it in a 500 milliliter bag of half normal saline. And with our Myers, that puts the osmolarity down at 225. So it's really in that hypotonic range where it's going to cause that fluid shift into the cells and really hydrate the patient on a cellular level. So I use this just as an example, again, with our Myers kit to show you that just by changing up the type and the volume of carrier fluid, how that really has an impact on the osmolarity of what you're infusing, and definitely something that you should be mindful of as you are putting together your IV protocols. We've covered a lot in the presentation, and I hope you've gotten some answers to your questions regarding compounding pharmacies and medications that you would need for your IV therapies. In closing, I just wanted to make sure that you know to use your compounding pharmacies as a resource for information. Here at Innovation Compounding, not only do we offer quality compounded medications for you to use for your IV and IM therapies, but we also are here to support you with those clinical questions that will surely come up on a day-to-day basis as you are offering IV therapies in your practice. We have a lot of resources for you, not only including our knowledgeable staff to answer your questions, but we also have our clinicians guides for each of our therapeutic lines. Our clinicians guides are a summary of evidence that we have collected and put into a nice resource for you. And then we also have our online webinar learning platform, our Innovation Innovation Institute, where we have various webinars on different topics, including IV and IM nutrition, just to give you a little bit more of clinical pearls and information that you can take and use in your practice. We have a full line of medications for IV and IM use, and then different ordering options that make it simple and convenient for you to implement these therapies into your practice. If you have any questions from the presentation, or if you'd like to connect about your own IV therapies or compounding needs for your practice, then please reach out to me directly at the information provided, or you can also reach out to the pharmacy. We would love to get to know you and your practice a little bit better to see how we can best support your compounded medication needs. Thank you so much for your time.